As the United States Senate continues this week to debate the new Republican health care plan, the focus of many states is adequate funding to treat and combat the epidemic of opioid drug addiction. Opioids, like heroin and prescription painkillers, now claim more lives in America than car crashes, guns, or HIV did at their respective peaks. More than 52,000 people died of an overdose in 2015. The last year for which statistics are available. Police, emergency rooms, and treatment centers are overwhelmed. For our Sunday Spotlight, MSNBC's Jacob Soboroff went to the epicenter of the crisis, the Ohio County with a grim distinction.
Dayton, Ohio. The Wright brothers built their first airplanes here and changed America forever. Today, the city is again at the center of an innovation, a deadly one sweeping across the country.
The deputy said that there was a car accident here, and they took one person out of the vehicle who they say had a 1,000-yard stare, was out of it, and so now he's in the back of the ambulance here. You literally just walked in to cash a check, and by the time you came back, your brother had gone and come back and got in an accident and then told the paramedic that he was on fentanyl.
Yeah.
What did he look like?
Oh, his eyes were glossy. You can barely open them.
What did he say to you? Nothing.
He loves me.
He said, "I love you." What did you say to him?
I love it.
What's it like to go through this?
Hell. Hell. Every day it is hell.
Over the past 2 years, fentanyl, a synthetic opioid that can be thousands of times stronger than heroin, has been flooding into places like here, Montgomery County, Ohio, where the overdose death rate has been skyrocketing. Through just May, overdose deaths in the county almost hit last year's total, and officials estimate this year's final number will double that.
We're on a pace to have 800 people die this year due to overdose in our county. Per capita, we're #1 in the nation in overdose deaths. Our job market's tanked. We lost all of our automotive industries, so I think it's driven by a loss of a good job. So people, I think they're depressed, they're self-medicating.
The first opioid of abuse was prescription pain pills, including OxyContin. But in response to media attention, access to pills were restricted, and in their place came heroin from Mexico, cheaper and more powerful. And then a couple of years ago, traffickers began mixing fentanyl into the heroin. And fentanyl is by far the most fatal drug of abuse America has ever seen. So you live around here?
Mm-hmm.
You said you have a nickname for this street.
Morgue Avenue.
Morgue Avenue.
It's not Morgan, honey, it's Morgue.
Which houses have people died in?
What houses have not died in? Really?
Really?
Really. Look at all these places, man. I've lived here for about, 5 years? And the last 5 years, it's unreal. I mean, in 47 minutes, there was already 9 deaths.
In 47 minutes?
On the street.
People are dying from what?
Drugs.
As the death rate skyrockets, the bodies come to the Montgomery County coroner, Dr. Kent Harshbarger, who performs tests to detect over 24 varieties of fentanyl.
Every vial represents somebody who's died.
Correct.
So this is what you call the cooler.
This is our cooler, our main cooler.
When did the bodies that are all around us come in here?
Over the last probably 24 to 48 hours.
And every day, bodies are cycling through here?
Correct. These trays will mostly be full by tonight.
What's the percentage of the bodies that are in here right now that are overdose deaths from heroin or fentanyl?
We were averaging 60 to 70% of our cases now are overdoses.
So 70% of the people that are in this room died probably of fentanyl?
Correct. That's correct.
If you could extrapolate from the numbers that you see here in Montgomery County, how many people across Ohio are going to be killed by fentanyl this year?
For our system, we cover about 1/5 of the state of Ohio, and we're estimating about 2,000 overdoses this year. If that continues, so that's about 10,000 for the state or more.
How is that not a mass casualty event? That is multiples of 9/11.
Oh, it is a mass casualty event. This is no different than some kind of mass casualty event in any other form. It's just a medical event.
A medical emergency.
I believe so. It needs to be recognized that way to bring some federal assets to help us.
And Jacob Soboroff joins me now live. Jacob, obviously this is a national crisis. This is a national epidemic, but particularly acute in the county you visited. Why there? What are the conditions there that make it so bad?
Yeah, it's a great question, Willie. Dayton, Ohio sits at the intersection, I should say, of Interstate 70 and 75, what law enforcement calls the crossroads of America for drug trafficking. Not only that, the industrial job loss that they saw in Dayton, which everybody saw across the Rust Belt, we talked a lot about during the presidential campaign, created what a lot of people call a sea of despair, and the drug cartels in Mexico just went right in and exploited it for financial gain.
Yeah, we're talking about deaths here in your report. You had another report, too, where you talked about the treatment of opioid addiction and how these centers are just frankly overwhelmed and they're having to use jails actually to accommodate some of these people. Is there hope that they'll get more bandwidth on that?
Well, that's the idea, but that's why everybody's got all eyes on the health care bill that's coming out of Washington. As you were reporting earlier in the show, hopefully or potentially this week, the idea is that Medicaid funding would go towards some of this treatment, but without it, jails for the time being, at least in Montgomery County, are going to be one of the primary rehabilitation centers, treatment centers for these addicts.
This has been an extraordinary week of reporting on this series for you. People can check it out at NBCnews.com. Jacob, thanks so much for being here this morning.
Thanks, Willie.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.